It is the personal touches that make hospices so special.
You can finish your cup of tea.
But right now they are doing so much more. Ashgate Hospice in Chesterfield is used to caring for the dying, but not like this. With the local NHS hospital near capacity, it's not only taking in people with a terminal illness, but coronavirus patients too.
I am really lucky I'm here. Yeah, I think if I wouldn't have got that ambulance that day, I don't think I'd have been here.
John was rushed to hospital with COVID and was then discharged to the hospice where he's now recovering. What's it been like here?
It's amazing. It's been amazing, isn't it? Like being in heaven here.
This hospice inpatient wing has been transformed into a COVID-only corridor. Every one of these rooms is occupied by a coronavirus patient. They're currently caring for 6. They have cared for more. Every single one of them was sent here from the local NHS hospital. Strict controls have suppressed any COVID outbreaks elsewhere in the hospice, but with the number of people cared for by all of England's charitable hospices up by a third on the first wave, the virus is taking its toll.
I've had to deal with 3 patients that have passed away during one shift. You know, it's hard sometimes to come to terms with what's happened, really.
We've always done end-of-life care, but I think it's been the turnover of patients and the turnover of the number of deaths in a shift.
This hospice runs predominantly on donations. Cake sales and fun runs fund this crucial care. To relieve the pressure, the UK government gave hospices £125 million this winter. Has that been enough to cover the care you're giving here?
No, it doesn't. The additional money is really very welcome, but it's only for just now. The NHS does not provide the care that we provide. They're not able to, they don't have the capacity or the capability, so if we're not here to do it, people will die in pain, they will die in distress in a way that isn't necessary.
The government says it's given hospices £275 million in additional funding during this pandemic, but that money runs out at the end of March while the patients keep on coming. Daniel Hewitt, ITV News.